Start.
Good morning. I am Dr. Mohan Damaskar, President of IMA Goa State. I welcome our press friends and I thank you for coming here with a short notice because we had given you a very short notice and I see a lot of so thank you for that. That's it. Now, on 11th of March, we are organizing a national workshop with conference, and it is being organized by Fonda branch IMA in collaboration with IMA State Goa. We are also collaborating with yes, Goa Chamber of Commerce and Industries, Pollution Board, State Pollution Board, SDMA, that is State Disaster Management Association, and other industries. But this is a national event, so, and we are getting Dr. Agarwal, Sharad Agarwal, who is a national president of IMA. He's a big personality. So he will grace the occasion on 11. Plus, we are getting speakers of national repute. Like, I would name some, Dr. Kaushik Sarkar, Dr. Surabh Dalal, Dr. Chetan Patel, Mr. Tariq Sahil, these are the major speakers who will impart knowledge and give lectures to our Goan doctors and the industry. Now, regarding this disaster management, see, disaster can occur anytime. There is no timing, magnitude, don't know, loss, we don't know. So the only way to combat it is preparedness. We have to be prepared for the disaster. We cannot, we have to be combat ready, like military. Anytime something else, we have to do. So in that direction, we have to prepare ourselves. And for to prepare ourselves, we require different groups, like firefighters, police, home guards, coast guard, ambulance, health services, doctors like us. When this disaster is overwhelming, that's big, then only Navy and Army comes in. But before that, we have to be prepared. So, in recent disasters, you must have noticed that there were some loopholes here and there. So, for that, we require specialized training in pre-hospital care, especially in the case of chemical-related disasters, as well as preparedness of hospitals with regards to such events. IMA has certainly a role to play in planning, preparedness, and the first responders in pre-hospital care to be trained. Planning of corridors for fast and safe evacuation of casualties, providing an estimate of the ability of local and regional healthcare facilities, both public and private, in meeting with the medical needs of the casualties. The plan is the need of the hour and one that can save lives by avoiding loss of precious time. In IMA this year, our theme is we have a theme like joining hands make heart work. So in that direction, we are training bystanders in compression only life support, what is known as POS. It is also a step towards pre-hospital care. This program is being carried out by all stand branches. Of course, that will be detailed by our Dr. Sandeep Naik. He will give you how we are going about us. So, and now this workshop is organized by IMA Ponda branch members, headed by Dr. Vallabh, who is the main coordinator and organizer. He has taken a lot of pains to organize this, and he has collaborated with a lot of industries, Goa State Pollution, SDMA, and all that. And we also thank those industries who have helped us in monetary ways. The goal of this program is to initiate a thought process of having local, regional, state plans in place as far as preparedness, disaster response and medical management are concerned. All the delegates will take this training to their respective institution and build upon knowledge imparted to them to make Goa a safer place in the world. We need preparedness. Goa needs preparedness. So we are working in that direction.
It's a one-day workshop?
It's a one-day workshop, wherein we are going to train the delegates.
And the delegates will be only from Goa or all over the country?
Mostly from Goa.
How many are expected?
170.
How you are going to train?
That he will come.
Full speeds.
And this year, coach, I've already told them.
Yeah, I am Dr. Sandeep Naik. I am the Honorary Secretary of the Goa branch of the Indian Medical Association. Thank you for coming for this press conference today. As our state IMA president has just said, preparedness is half the battle won in management of any challenge, especially a natural or industrial disaster. Now, of late, we are seeing an escalation in the occurrence of sudden deaths, in seemingly healthy persons due to cardiac arrest, and almost 80% of these cases occur in households, in malls, in shopping complexes, even in clubs, etc. And by the time the expert help is reached, or the person actually reaches a hospital, it may be too late, as the organs actually stop working due to lack of oxygen supply. Now, the person in the immediate vicinity, the bystander, plays a vital role in deciding the survival of the victim, as time available is just about 3 to 4 minutes after the heart has stopped functioning. Now, our theme this year is joining hands to make hearts work, under which we have devised compression only life support technique, now which is actually perfected by the team at the Indian Resuscitation Council, and we have adapted it to our Goan scene, and this will equip every bystander to respond quickly and effectively to cardiac arrest. We use the PowerPoint presentations, videos and mannequins to demonstrate the technique and supervise the hands-on training of anyone who approaches us, like from housing societies or clubs, social organizations, colleges and schools. So we request through you all, every such organization or housing society or clubs, schools, colleges to contact any of our doctors, and we will come to your premise at your time with our mannequins, with our PowerPoint presentations, and train each one of you on giving a hands-on training to conduct this technique. Now, this is slightly different from the regular CPR training that all of you all are familiar with. In regular CPR, you have to give mouth-to-mouth resuscitation. Now what happens particularly after this COVID pandemic, everybody is afraid of this, and rightly so, that you cannot actually directly give mouth-to-mouth resuscitation to someone whom you don't know. So this technique, which is called as compression only life support, entails only giving chest compressions, and which is proven to be equally effective in reviving somebody who has cardiac arrest. So this is something that we are going to teach along with the theory behind it, and we will explain entire everything. And in a 2-hour workshop, we will conduct these all over Goa. All you have to do is contact any of your doctors who will contact us, and through our various branches in Goa, we will come and conduct this for you all. And this will be an entire yearly, full year 2023 endeavor, and we will cover as many people as possible in this entire year. Thank you.
Doctor, do you have Goa-related figures of sudden deaths, and what do you attribute these deaths, sudden deaths?
That's an entirely different thing. So this is like there are various reasons, and usually what happens is this analysis takes a long time. We cannot suddenly attribute it to something or the other. But one of the things is that because of this COVID pandemic, definitely there has been a definite increase in the number of sudden deaths. How much it really affects in what modalities, this requires detailed analysis, and it will take at least another year for people to come out with the reasons. But it is definitely happening.
It's because of COVID pandemic.
No, that's as I said, we cannot be 100% sure. This requires a lot of analysis to be,
Yeah.
these are scientific things. So these are observations now.
It is one of the reasons.
Yes, it could be one of the reasons, because there are certain things which are happening in the cardiac this thing and all that, which could be affecting this.
Because even the age, lesser age people.
Yes, exactly. That is what is worrying, because it is happening in the younger people. It is happening in seemingly normal people who really do not have any other antecedents which could affect this. So that is one of the reasons why this particular goals that we are teaching, compression only life support, will be a boon if everybody understands this, and by the time expert helps arrives, and everyone can learn this and do the cardiac compression, the chest compression, sorry. This will actually help in reviving and increasing the survival rates.
So this workshop will be free?
No, this is, there are delegates who have, there are delegate fees, 1,200 for the doctors and nurses and all, and 1,500 for the other people.
We will be extending with the invitation to be there for the function, which is on. I am Dr. Vallabh Daimodkar. I am a member of IMA Ponda, and I am also a member of Disaster Management Committee at the government level. I was also a member secretary of IMA Disaster Management Cell. At the national level, we have a body, state level, local level. I am very fortunate that this year, by virtue of my specialty, that is occupational health and industrial medicine, which I have been practicing for the last 30 years, number one. Secondly, IMA Ponda and my specialty came together, and we decided to start a first aid training academy. This is the brochure of the academy which we have given you, and this is Pan-India recognized academy wherein we give first aid training of 5 days, 1 day. And to add to that, we have realized lot of training is required at the community level. Bystander means a person who is a lay person who doesn't know anything. And I am grateful to President Dr. Mohan and Dr. Sandeep and his entire team who has taken this theme to train as many community level people known as bystanders so that they could save the life. Now, as you asked, by giving chest compression, out of 10 patients, depending upon the cause, you can save as many as 2 to 3 patients or 4 patients. It depends upon the cause, but most of the time, only chest compression is going to help. Now, as it is said, mouth-to-mouth cardiopulmonary resuscitation, this is a foolproof, but at least a chest compression when you give, it is definitely going to be very, very effective. And we had the inaugural function launching of this course program at Goa Medical College, when we had expert faculty from KM Hospital, Dr. Deepa Kane, Also Dean Dr. Bandekar was there. They have also realized that this is definitely going to help people in saving life. This is what we are trying to do. IIM Goa State. I think we have already taken
Yeah,
around
already
25 to 30 sessions at
More than
different-
that, more than
They're
that.
already
More than
starting
that.
already.
And we are not only that, at Pondap, we have already given one session for the press people.
Yes.
We would like you also
Also to come.
to be approaching us and you tell us where you want. What we want, and these programs are absolutely free programs. We come with a mannequin and we look like it. So
We would like you all to percolate this message to the masses so that they know it. Through the press media we can go. That's what I feel.
let us organize one session for all press media so that
Yes.
we will be in a better position to understand.
Understand what exactly we are doing.
And we have got 7 local branches. Iswadi, Bardes, then Bicholim, Citrus, Ponda, Mormugaon, this way. Now coming to the conference of the main conference that we are planning to have is, you all know disasters are well known everywhere. Natural disasters, floods are there, tsunamis can occur, cyclones can occur. Now Goa is as far as Goa is concerned, with the development that has taken place, chemical disasters and techno-industrial disasters are on the rise. Because there is already an NGO known as Green Triangle Society, which is concerned with the environment, health and safety of the communities. We have got a lot of manpower. There are people employed in mines, which is closed down to some extent now. Factories are there, dock workers are there, shipping people are there. There are unorganized industries like agriculture and many more, wherein people are exposed or likely to face the disasters. The whole idea is to sensitize the people, to make them aware what the disaster is, because it comes unwarranted, as Dr. Namaskar said. So, awareness, then the preparedness, and then how to actually act when there is a disaster. So these are the situations. Now when situation is like this, state government under State Disaster Management Authority, wherein Chief Minister of Goa is the chairperson, they have been very kind enough to support this program of workshop on disaster management and medical management of chemical disaster emergencies. Now it is not only the doctors, we can handle only the emergency part, medical emergencies. But if you see the reality, the first responders under State Disaster Management Authority, South District and North District. These are the 2 districts where they are the nodal officers. So collector gives command whenever there is a disaster. And so police, fire and health department are the first responder, they are called first. Then subsequently comes the other agencies like Water Resources Department, Public Works Department, Transport. So these all are stakeholders. Now there are major industries. If you ask me the industry, there are 4 types of industry. Major accident hazard unit, wherein by virtue of the amount of hazardous chemical that they store, transport and handle, there are more chances of getting disasters. So risk is involved. So taking into consideration all these, safety part, the environment protection part and the health part, we are having this program on disaster management. Now as regards the delegates, apart from doctors and members of Indian Medical Association, there are participations coming from the industries, from all sectors. There are participations coming from the government departments, most of the government departments. And there is also participation coming from other stakeholders. We are fortunate enough to get the support from Goa Chamber of Commerce and Industries, because there is also a medical cell under Goa Chamber of Commerce. I incidentally happen to be the member of this cell also. And Goa State Pollution Control Board and GCCI, they have been kind enough to support this. The program is organized on coming Saturday, 11th of March, at Sanskriti Bhavan, Patopanchi. The expected participation of the delegates is around 175 to 200. We also invite you to see what the program is and to also give us the press coverage. And the proceedings of this conference and the workshop in the form of a pen drive, we are going to give it to the authorities. North Goa, South Goa, the state collector, we are going to give it to the chief minister. And when we visited chief minister, who is the chairman of the SDMA, Goa, he was very happy to know that after a pretty long time, such a conference is getting organized, which was a much awaited requirement. We are fortunate enough to get Dr. Sharad Agarwal, the National President of IMA, who is going to inaugurate a session and going to be the chief guest. So this is all regarding the disaster management. You know, recently there have been so many accidents and incidents occurring. Now, government is having off-site disaster management plans. Now, all industries, major industries, they are having their on-site disaster management plans. So, in between off-site and on-site comes the disaster management plan for a mutual aid group. It is very important. Suppose then, for example, whenever there are major accidents happening, it has happened in Verna, it has happened in Kundaim, it has happened in Pilar, it has happened. Wherein, when there is a mishap occurring, there was a fire. And before government resources would reach there, the nearby bigger industries, because of their mutual aid, they could come and help in the firefighting. So this is how the mutual aid group helps in a disaster management. To give you a simple example, in industries there are different zones, and bigger companies might be having an ambulance, they might be having first aider, they might be having firefighter. But when there is an emergency and disaster, all these companies, they come together and try to support the industry which has been victimized because of the mishap of the accident. This is also at the community level. This is also at the suppose there is a cyclone or there is a flood. It is the responsibility, let us not rely upon government 100%. We have to sensitize the people, and thereby we can save the lives of many. Few years back when there were floods in Kanpur, our IMA disaster management team, we visited. Our actual role was not during actual disaster, not in the activation phase, but in the restoration phase and then the recovery phase. So we play, medical professionals play very important role in the recovery stage of